Hello everyone. Very good afternoon to all of you. I guess I'm live, I'm clearly visible, audible? Yes? Yes. So very good afternoon to all of you. I am Dr. Priyanka Sachdev here and I welcome you all for today's session. So let me start it quickly. So today I'm going to tell you the approach to system-wise microbiology, the need of the hour. You have to understand this approach if you are a second Prof MBBS student especially. So let's start it. Okay. So are you a medical student, MBBS student in India? If you are a medical student in India, you must know the NMC CBME new guidelines have completely transformed the way we learn microbiology since 2019. You must be knowing that. Yes or no? Yes or no? So, what is the shift? So, basically, before 2019, we used to study microbiology organism-wise. Yes or no? So, we divide the systemic microbiology into 4 portions: bacteriology, virology, mycology, and parasitology. Before 2019, that was the approach. But after 2019, because of the new NMC CBME guidelines, we have shifted the approach to system-wise microbiology after 2019. So in system-wise microbiology, we divide the systemic microbiology not into these 4 portions. We divide them into 9 basic major systems of human body, that is CVS, GIT, hepatobiliary, skin, soft tissue, respiratory, CNS, urinary, genital, and miscellaneous. You may be knowing now students are facing a major trouble in this shift. I guess everyone is knowing about this shift. Okay, got it. So this is the shift. I guess everyone, so this is the shift before 2019 and after 2019. The major shift which occur in microbiology curriculum. Yes or no? So have you ever thought why this shift occur? Have you ever wondered why NMC have decided to change the curriculum? There is a reason behind that. Yes, there is a reason. Let me tell you that reason first before coming how to adopt with that change and what should be the approach. Let me tell you that. So the reason is, initially when the approach was organism wise, we used to memorize the organism. Okay, but now when the approach is system wise, we have to understand how these organisms affect each system in human body. We have to understand it. So we are shifting not organism wise to system wise. We are shifting from memorizing to understanding. So we don't have to mug it up. We have to understand it. Got it? This is the first reason why we have shifted the curriculum from organism wise to system wise. Now, the second reason, this new approach mirrors how a doctor think in real life scenario. Suppose a patient coming to you. What is the ultimate aim of all of us, of all the doctors? The ultimate aim is to treat our patients, of course. So suppose a patient come in your OPD. Suppose, okay, what does the patient will say? Patient will not say to you that, doctor, I'm having a bacterial or viral or fungal or parasitic infection, kindly treat me. No, patient don't say this. Patient will not say this. What the patient will tell you? The patient will say the symptoms. What are the symptoms? The patient can have many symptoms, any of the symptoms. So based on the symptom, and taking the detailed history and examining the sign, okay, we doctors will decide which system is involved, which human system is involved. Of course, one of them should be involved or multiple can be involved together. Okay, so based on the symptoms, based on the signs, based on the diagnosis, based on the history taking, we will decide the system. Now in each system, each of these 9 systems, there are 4 infectious etiology. Suppose in CVS, bloodstream and CVS, take the first system. The infection can be due to bacteria, can be due to virus, can be due to fungus, can be due to parasite. The same will occur in each of the system. So patient will not come to us with the bacteria, virus, fungus or parasite etiology. Patient come to us with the symptoms of one of the system. So that was the need of the hour to change the shift, to shift this approach, I mean, from organism wise to system wise. Organism wise, understanding wise, it's easy. But when we try to practice in real scenario, real clinical scenario, we feel difficulties. That's why this shift is there. Now, what are the challenges due to this shift? I guess you all are facing these challenges. So what are the challenges you are facing due to this shift? So it's not always easy to adopt. I know it's not always easy to adopt. Let me tell you my story only. I'm teaching microbiology since last 9 years. And when this shift have occurred now, I myself feel a very difficulty in adopting the change from organism-wise to system-wise while teaching. And I'm feeling like I'm teaching a completely new subject. So I can understand the situation from the student side also. Okay. So students are struggling to find the right resource and the right strategy to tackle this change. Till today, they are struggling. Since 2019 onwards, they are struggling. I am assuming this. Yes or no? Is it the case? Yes or no? So that is the thing. So let's come ahead. So what is the approach? How to deal with this change? So first you tell me which approach is right. The initial, many students still tell me, ma'am, the initial approach was right. The bacteriology, virology, mycology and parasitology, it was a simple approach and we can understand the microbiology better. But many students tell me, no, this is the new approach, and because we want to practice ultimately after passing, so we have to understand from a patient point of view and we have to understand it systemic. So according to you, what is the better approach? Can you tell me? Yes. Which is the better approach? Is it organism-wise or is it system-wise? What is the better approach? So answer is none of them. None of them is best. None of them is right. None of them is wrong. So actually you have to integrate. The two approaches. So you cannot understand system-wise microbiology unless and until you must understand them organism-wise. I cannot teach you directly the organism which cause infection in CVS, GIT unless and until you know the name of bacteria, viruses and fungus and parasite. You should be familiar how many bacteria are there in the world or medically important bacteria, how many viruses are medically important, how many viruses, how many parasites. First you have to understand organism wise, you have to enumerate them, and then each of them you have to divide them into these 9 systems. You are getting my point? So this integration. Here in this session, I will not teach you the systemic microbiology. I will tell you the steps to understand it. What are the steps? You have to follow it unit by unit. So there are 9 units, 9 systems in your syllabus. Now, unit by unit, I will tell you a simplest approach. Please follow that and you will see the change. Okay. So let me tell you. Yes. So let me tell you how to do that. Okay. So actually, you have to integrate the two approach, the old approach as well as the new approach. How to do this integration? So over the time, I discovered some effective strategies that make it easier. So you can study smarter, not harder. In this session, I am going to give you a structured approach to navigate system-wise microbiology with confidence. So listen the steps carefully one by one. First of all, let me tell you, I have done a color coding. I have given 9 colors to the 9 system. I will show you which 9 colors I have allotted, one color to each system. Okay, we have done the color coding and I will merge that color coding with the old organism-wise approach. I will merge that. Okay, so let me tell you. So before I come on the approach, let me tell you what I'm going to tell you in this session. In this session, first of all, I will tell you the 4 microorganisms which cause infection in human body. Then I will tell you the classification of each of them. Classification of bacteria, classification of virus, classification of fungus, and classification of parasite. You must know the organism. You should know the name and in which category they are falling. First of all, the first step, the basic step. If you don't know the classification of these 4 microorganisms, you can't understand microbiology. First, they should be at the tip of your tongue. There are total approx 150 microorganisms in your syllabus. You should know their names well. You should enumerate them, you should classify them. After that, you come on the systems. So we divide the human body into 9 major systems and I will give color coding to each of them. So 9 colors I will use in this session. I will allot one color to each system. These are the 9 systems you can see. And after that, I will tell you in each system how many bacteria, how many virus, how many fungus, how many parasite are causing infection in that particular system. So one by one, system by system, we will take and we will see the 4 infectious etiology in each system with the help of that color coding. And finally, I will merge the 9 colors into the classification and you have to stick that in your wall to understand which bacteria is causing infection in which system. It is not always necessary that one organism causes infection in one system and in one system infection is due to one organism. No, multiple organisms can cause infection in one system and one disease also can be due to multiple etiology. So we use multiple colors there. So please see, you will understand it better once you will realize. So let's start it. Okay. I will come on your query. Okay, Mars Zuberi, I will come on your query. Okay, listen now. So there are 4 microorganisms: bacteria, virus, parasite, and fungus. Now let me tell you their classification first, without which you cannot proceed. So we classify bacteria based on the shape and gram staining. We classify viruses based on their nucleic acid, is it DNA or RNA? So we have DNA viruses and RNA viruses. We classify parasite based on their cellularity, whether they are unicellular or multicellular, that is protozoa or metazoa. And we classify the funguses based on their pathogenesis. Let me tell you the detailed classification. Let's come on bacteria. Bacteria. So as I told you, we classify bacteria based on 2 things, the shape and the gram staining. So based on the shape, we classify bacteria into 2 categories. You know, there are certain bacteria which are spherical in shape. The spherical bacteria are known as cocci. And there are certain bacteria which are elongated in shape. The elongated bacteria are known as bacilli. They are rod shaped. Okay. So based on the shape, they are of 2 types. Everyone knows this. Based on the gram staining, again, bacteria are of 2 types. Okay. The violet one, the violet color are gram positive. And the red color are gram negative. So based on the shape, they are of 2 types, cocci, bacilli. Based on the gram staining, again, they are of 2 types, gram positive and gram negative. Let's combine the 2 classification together. The shape as well as gram staining. So bacteria are of 4 types. You can see this is gram staining, this is shape. What are the 4 types of bacteria? Gram positive cocci, gram positive bacilli, gram negative cocci, gram negative bacilli. So these are the 4 categories. We divide the bacteria like this. Okay. So you can see the 4 diagrams. Appreciate their shape and appreciate their color. You will realize. Okay. What is the shape here? Cocci, bacilli, bacilli. Appreciate the shape. Now say the color, is it violet or red? This one is violet, so it is gram positive cocci. This one is red, so gram negative cocci. Again, this one is violet, so gram negative bacilli. And again, this one is red, so gram negative bacilli. This one is gram positive bacilli. So we divide them in 4 categories: GPC, GNC, GPB, and GNB. Now the question is, which bacteria is coming in which category? And a 5th category, miscellaneous, also exists. Okay, the bacteria which are poorly gram stained or which are cocobacilli in nature, we put them in miscellaneous category. So these are the bacteria. You can see these are the bacteria, total bacteria in syllabus, in MBBS syllabus, we have to study. There are more bacteria in the world exist, but medically important are these one only. We have to study in our syllabus, in MBBS syllabus. Okay, we are dividing them in 5 categories: gram positive cocci, GPC, gram negative cocci, GNC, gram positive bacilli, GPB, and gram negative bacilli, GNB. Okay, and the 5th category is miscellaneous. You have to learn this classification. In GPC, for example, only 2 bacteria are coming. The mnemonic is SS, staph and strep. Only 2 are coming, staph and strep. In gram negative, only 2 are coming, both the Neisseria NN. Both the Neisseria NN. In gram positive bacilli, there are 6 bacteria, A, B, C, D, L, M. The mnemonic is A, B, C, D, L, M. You can see A, B, C, D, L, M. And remaining all, whatever left, is falling in the last category. You can learn like this. So I'm not reading the classification, I'm telling you an approach. So please, first of all, learn this classification, the bacteria. After that, coming on the viruses, we classify viruses based on the nucleic acid. You know, this is the structure of the viruses. Now, viruses have nucleic acid, either DNA or RNA, never both. Never both. And this is the basis of classification. So we divide the viruses into 2 categories. The DNA viruses, there are 6 families. And RNA viruses, there are 14 families having multiple members inside that. The 6 families of DNA viruses, the mnemonic is HHAPPP, total 6 in number. And 14 RNA viruses, there is a mnemonic to learn. The mnemonic is ABCDFORTP. Total 14 are there. You can see the name of the viruses. You can see the DNA viruses, as I told you, 6 families, HHAPPP. And you can see the 14 RNA viruses, the 14 families of RNA viruses. You can see A, B, C, D, F, double F, O, R is triple R, and TP. You can learn this classification well. Okay, in the detailed videos, everything is taught to you. But here I'm telling you an approach, how to shift from the organism-wise to system-wise and make the color coding and make the master charts. I'm telling you that approach here. So you can see the viruses classification. So we have seen the bacteria's classification. We have seen the viruses classification. Now coming on parasites. The third are parasite. We classify parasite based on their cellularity, whether they are unicellular or multicellular. If they are unicellular, we call them protozoa. Okay, and if they are multicellular, we call them metazoa or helminth. Metazoa and helminth is one and the same thing. Okay, here also we divide them in 3 major categories. Here also we divide them in 3 major categories. You can see. So you can see this is protozoa, this is metazoa, unicellular, multicellular. We divide the protozoa into 3 major categories: the amoebas, flagellates, and sporozoans. And metazoa also we divide them in 3 major categories: nematode, cystode, and trematode. cystode, trematode, and nematode. Okay, you can see the detailed classification, the organism which is falling in each category that you have to learn. The third is parasite, and fourth and last is fungus. The first thing, people, please learn the classification of the 4 organisms, without which you cannot proceed for microbiology. You are not allowed to enter. This is the license for reading, for studying microbiology. You should know the name of organisms, all bacteria, all virus, all fungus, all parasite, and their classification, in which category they are falling. If I say the name of any parasite, suppose I am saying you Phaeolopsis busky, so you should know it is a metazoa, it is not a protozoa. In the metazoa also it is one of the trematode. In the trematode also it is an intestinal trematode. That you should know exactly for each and every 150 organism. Okay, now coming on the fungus ka classification. In the fungus, okay, we divide the fungus based on their pathogenesis. They cause 5 type of diseases. Pathogenesis means disease. There are some fungus which cause superficial diseases. The disease of the keratin, skin, hairs, and nail. Disease of the keratin, disease of skin, hair, or nail. So that is superficial mycosis. Okay, ringworm will come here. There are certain funguses, they cause infection just below the skin. That is subcutaneous, not superficial. They cause subcutaneous mycosis. So some fungus cause superficial infection, some cause subcutaneous infection, subcutaneous mycosis below the skin, and some cause systemic mycosis. Systemic means they go in the blood and disseminate in multiple organs. So they enter via respiratory route, they enter in lung, and from the lung they disseminate in multiple organs. That is systemic mycosis. And the fourth one, opportunistic mycosis. Opportunistic mycosis are the fungus, they do not cause disease in healthy individuals. No, they need an opportunity to enter in human body. What is that opportunity? Opportunity is low immunity. Whenever there is an immunodeficiency, that is an opportunity for this fungus to enter. So anyone who is having AIDS, HIV, the person is on chemotherapy, the person is on steroids, so the immunity is less, and at that time they can have opportunistic mycosis. Healthy individual with normal immunity cannot have these infection. And the fifth one is mycotoxicosis. What is mycotoxicosis? Here fungus do not cause a disease. The toxin secreted by the fungus will cause a disease. Fungus do not cause disease in human. The toxin secreted by fungus will cause a disease in human. So we are dividing the fungus in 5 categories. You can see the names, in which category which disease is there, which fungus causing which disease is there. So this is the basic classification, people. This is the basic classification. So first of all, I taught you the classification of the bacteria, virus, fungus, and parasite, and I am assuming that you know at the tip of your tongue. First of all, you divide the bacteria in 4 categories: GPC, GNC, GPB, GNB. You divide the virus in 2 categories: DNA virus, RNA virus. You divide the parasite into 2 categories: protozoa, metazoa. Okay, here DNA and RNA. Okay, and here you say GPC, GNC, GPB, and GNB. And you divide the fungus into 5 categories based on the disease they are causing: superficial mycosis, subcutaneous mycosis, systemic mycosis, opportunistic mycosis, and mycotoxicosis. So this is the classification I want all of you to learn at the tip of your tongue. Rather, you should take the printout and stick it on your wall. So total approx they will be around 150 organism if you say. So first of all, learn their classification. Now I will shift the approach from organism-wise to system-wise and see how I am shifting. So you can see these are the major systems in human body. We divide the human body into 9 major systems: CVS, GIT, hepatobiliary, skin, soft tissue, and musculoskeletal, respiratory, CNS, urinary, genital, and miscellaneous. In the miscellaneous, we will take congenital infections, oncogenic organism, ocular ear infection, or zoonotic organism. Miscellaneous will come here. So we are giving one word color just to understand. Okay, these colors are not universal. I mean, I have given these colors. You can take any color. Okay, you can allot any color to one system. But the thing is, you should take 9 different colors for 9 different systems so that we can do the integration. Okay, so I have taken these 9 colors. You can see I have allotted red color to CVS, purple color to GIT, pink color to hepatobiliary, blue to skin, soft tissue, like that. I have taken this, and my entire microbiology will be based on this color coding. So I have allotted one color to one system. Now each of the system have 4 etiology. Like CVS. In the CVS, there are bacteria which cause CVS infection, viruses, parasite, and fungus which cause CVS infection. Same occurs with GIT. In the GIT also we are having these 4 etiology: bacteria, virus, fungus, and parasite which cause GIT infection. Now I will give the color to each bacteria, virus, fungus, and parasite, the same color in that chart. I have given you the classification that we will do. You are understanding what I am saying? So each of them have 4 etiology. So you can divide each system into 4 categories: bacteria, virus, fungus, parasite, each system. So tell me the name of the bacteria, virus, fungus, parasite which are causing infection in that particular system. In CVS, how many bacteria cause infection? You should know the total bacteria. Among those, how many cause CVS infection? Among all the parasites, how many cause CVS infection? Among all the virus, how many cause it CVS infection? And among all the parasite, how many cause it? Like that. So we will do the color coding and it will be very easy. Take my words, believe my words to understand it. You are getting it what we are doing. So do this color coding. Now one by one I will take the 9 system and I will show you how I have converted this complex system wise approach into the most simplest one. I will take these system one by one and I will show you 5 columns in each of them. Okay, suppose I will take the first system, CVS. So first of all I will tell you the syndromes. Okay, the syndromes associated with that system, and then bacteria, virus, fungus, parasite causing infection in that particular system. So we are dividing each system into 5 categories. Let's take first system. Okay, 9 we will take. Let's take the first system, CVS, bloodstream and CVS. Okay, you can see the 5 categories and you can see the color I have used. I have used red color. Okay, so you can see the 5 categories. You can see the syndromes in CVS. You can see these are the bacteria which cause infection in CVS. These are the parasites which cause infection in CVS. These are the viruses which cause infection in CVS, and these are the fungus which cause infection in CVS among the total. I'm assuming you know the total. You know total bacteria, total virus, total fungus, total parasite. From them, these one are causing infection in CVS. In the end, I will give color code there also. Don't worry. You are getting it what we are doing. So this is CVS. The same we will do for GIT. Let's come on the GIT. In the GIT, again the 5 categories you can see. You can see these are the syndromes in GIT. This is the way you have to study the systemic microbiology, system wise. Okay, these are the bacteria, parasite, virus and fungus which cause infection in GIT among the total. You know the total. Okay, these are the one which cause infection in GIT only. Okay, the same with hepatobiliary. You can see there is no bacteria which cause infection in hepatobiliary system, and there is no fungus which cause infection in hepatobiliary system. There are only viruses and only parasites are there. You can see I have enumerated the viruses and parasite along with their diseases also. I have mentioned the diseases also, which organism causing which disease. Okay, and syndromes. So total 5 categories are there. You can see. Now coming on skin, soft tissue and musculoskeletal. Again the 5 categories, you know, these are the syndromes. These are the bacteria, parasite, virus and fungus which cause infection in skin and soft tissue and musculoskeletal system. From the total bacteria, first people learn the classification and from them pick them up one by one, that which bacteria, virus, fungus and parasite causing infection in which system. First of all, you see that, and name of disease also along with that. Coming on the respiratory, you got the approach, you got the color coding. You can see the same 5 categories, the syndrome, bacteria, virus, parasite and fungus causing infection in respiratory system. Okay, the same occurs with CNS. You can see the CNS, the same categories. You can see bacteria, virus, fungus, parasite along with the syndromes. The same occurs with urinary tract. The same occurs with genital tract and same occurs with miscellaneous. In miscellaneous, I am taking 4 things: congenital infection, zoonotic infection, ocular and ear, and oncogenic organism. So you can see the categories here in the miscellaneous also. So basically we have taken the 9 systems. These are the 9 color codings, the 9 human body systems. Okay. 9 systems we have taken and we have given one color. You can see the 9 colors I have used, the red, purple, pink, blue. You can use any color. Don't take, these are not universal. I'm saying these are not given by universally. These are taken by me just for the sake of understanding. You can take of your own any color coding for any one system. But the thing is that from total bacteria, total virus, total fungus and parasite. Bacteria, virus, fungus and parasite. Now you allot this color to this classification. This is our new approach, the system-wise approach, and this one is our old approach. Old approach is organism-wise. Okay, now we have to use this color coding there to understand that from the total bacteria, how many cause infection in CVS, how many cause infection in respiratory, how many cause infection in CNS, how many cause infection in GIT, how many hepatobiliary, urinary, genital, like that, and miscellaneous. So here I will give 9 colors. Okay, I will show you the chart. I have made this. It took a long, very many months to create these master charts for you. I call them master charts. I will compact the entire systemic microbiology in just 20 pages with the help of these master charts. I will compare them in comparative columns in the end. You will realize that microbiology is the most simplest subject out of the 19 with this color coding and master chart creation. It will be super simplified. Believe my words and follow this strategy. The same we will do for the viruses. Among the viruses which cause infection in CVS, which cause infection in respiratory, GIT, hepatobiliary, like that, I will give 9 colors here. Same, I will give 9 colors here and 9 colors here. So let me tell you the 9 colors charts of bacteria, virus, fungus, and parasite. I hope you are understanding what we are doing. You have to understand these classifications first, the 4 classification: bacteria, virus, fungus, parasite. Then you have to see among those bacteria how many cause infection in each of the system, among the virus, among the parasite, and then you have to integrate the two. Integration is the main thing, and that's what I have done for you. Okay, it's like a platter. It's already served in front of you. You have to just eat it. See, this is the bacteria. I have already taught you the classification of bacteria. People, I have already taught you the classification of bacteria. You know this. We divide the bacteria in 4 categories. You know, GPC, GNC, GPB, GNB. You know this classification. Let me give you the 9 colors. Among all these, how many cause infection in CVS? How many cause infection in GIT? How many cause infection in CNS, respi, urinary, genital? See, this is the same classification. The same classification. I have given 9 colors. You know the color coding. You should know the color coding. So red is my CVS, I know. Green is my CNS, I know. Like that. Okay, purple is my GIT, I know. So I can see which bacteria is causing infection in which system, and I know the name of the disease. I can just the name of the disease. I hope you are understanding this approach. The same occurs with the viruses. You can see this is total viruses. You can see DNA viruses, RNA viruses. 6 DNA viruses, 14 RNA viruses. Let me give you the 9 colors. You can see the 9 colors, the DNA and RNA viruses. The same occurred with the parasite. You can see the parasite, the protozoa, metazoa. Let me give you the system-wise approach to this. You can see the 9 colors I have used. And same occurs with the fungus. You can see total fungus. We divide them in 5 categories: superficial, subcutaneous, systemic, opportunistic, and mycotoxicoses. You can see the color coding I have done here. So which fungus is causing infection in which system? So now comes the concept of master chart. Okay, so how to compact all this? So till now what I taught you, till now I guess I taught you total 13 master charts. What are these 13 master charts? In which first I taught you learn the classification of bacteria, virus, fungus, parasite. One bacteria classification, one virus classification, one fungus, one parasite. So total 4 of classification and 9 of the color coding. So 9 plus 4, total 13 master charts. That is your hit. You have to stick on your wall and you have to learn it thoroughly. The old approach, the new approach, and integration of the both. You have to learn it very thoroughly, people. Okay, number 1. Now, how to see the details? Now, most of the students may be thinking, ma'am, this is just a classification you taught us. But how to learn the details of each organism? You told 150 organism in our syllabus. I agree. Many bacteria, virus, fungus, parasite. But how to learn the details of each organism? That is your question. No? In your exam, you are getting the question not only on classification, but on the details also, of course. So details also we will study in the form of the master chart. Okay. Okay. Now listen. So suppose I will take an example, only one system. The similar I will do for 9, but I cannot teach you all 9 systems here. So first system, for example, I am taking here CVS. For example, you can see this is my master chart of CVS. Let me explain you who are not understanding. In the CVS, I have given red color coding. Okay. So I am dividing the CVS into 5 categories. The syndromes in the CVS, that I will teach you separately. Okay. And the bacteria, viruses, parasite, and fungus which cause infection in CVS. Now, how many bacteria cause infection in CVS? You can count here. How many are there? You can see there are 7 bacteria. You can see the name of the disease also. So I will compare all 7 bacteria in a one row under a fixed set of heading. We will fill this master chart during live classes. You can fill with me simultaneously. Suppose I am taking the first bacteria, Salmonella typhi. Then we will take the second bacteria, Rickettsia, then Brucella, Leptospira, Borrelia, Staph epidermidis, Strep viridans, like that. So one by one, the same sequence you can see here. The same sequence, one by one, we will take them here and we will study them under a fixed set of heading. And the most important point, we will start writing here. In the introduction, you have to write the scientist who discovered these bacteria in each of them or some important point. Then morphology, I will tell you which of them is capsulated, which of them is spore forming, which of them is motile, yes or no. In the mode of transmission, like that, I will cover all the headings one by one. Okay, this is for bacteria we have done. Now come on parasites. See how many parasites cause infection in CVS you can count. 1, 2, 3, 4, 5, 6. So you can compare them under a fixed set of headings. So these are the parasites: Leishmania donovani, Trypanosoma brucei, cruzi, and Wucheria bancrofti. So in Leishmania donovani, I will take both Leishmania, the visceral, cutaneous, like that. So here we will compare them. So you can see the parasites I have taken here and I have compared them under a fixed set of heading. The same we will do for viruses. We have taken the viruses. You can see how many viruses: retrovirus, arbovirus, arenavirus, and bunia virus. Total 4 viruses. You can see retrovirus, arbo mein all will come. Chikungunya, dengue, all these. Chikungunya, dengue, KFD, Ebola, Marburg, they all will come here. Bunia and arena. In this way, we will compare them under a fixed set of heading, and the same we will do for the fungus. You can see the 5 fungus which cause infection in CVS: histo, blasto, coccidio, paracoccidio, and candida. So we will take them: histo, blasto, coccidio, paracoccidio, and candida, like under a fixed set of headings. The headings are different for bacteria, viruses, fungus, and parasite, but the headings are fixed. For all bacteria, they remain same. For all viruses, they remain same. For fungus and parasite, like that. So we have completed the first system. Then we will come on second system, like GIT. Again, we will compare all bacteria of GIT, all viruses of GIT, all parasites of GIT, all fungus of GIT. Then we will come on the third system. Likewise, we will take system till 9 systems, and we will compact the entire microbiology in just 20-30 pages with these master charts. And I challenge you, whatever is important, it is coming in your university exam or your competitive exam, that is NEET, ICT, or FMGE, that will be from these master charts. You just make these master charts with me. You have to revise these 20 pages before going to your exam, nothing else in microbiology. And take my words, take my challenge, every question, whether it is university exam or whether it is competitive exam MCQ, tricky MCQ, clinical MCQ, image-based MCQ, any MCQ, that will be from this master chart. Master charts, you know, it's a real game changer. You can't believe it's a game changer. So that's the thing. So the most important question, where all these things are happening and how we will study all these bacteria. So I'm proud to announce, I'm happy and feeling overwhelmed to announce my new course, which is launching on MedLive by Dr. Priyanka app. The name of the course is Prof Buster Batch. Okay, and we are starting the first batch. The first batch is progenitor batch, which is starting from February. 10th February 2025, we are starting this batch. The next Monday, we are starting this batch, in which I will teach you not only microbiology with the new CBME curriculum, the System-Wise Microbiology. I will teach you patho and pharmacology also. So basically, I am teaching all 3 subjects of second prof with the latest CBME curriculum in all of them. Okay, especially students are feeling difficulty in microbiology because the approach has changed. So we will take them. So in this batch, in this course, which is happening on MedLive by Dr. Priyanka app, it's an online course. It's an online live series. It's not offline, it's online, where all 3 subjects of second prof are dealt. So it will be highly beneficial for second prof MBBS student. The entire subjects, complete 3 subjects, their theory, their practicals, their MCQs, everything will be covered in 3.5 months. So I will give you a dedicated schedule of 3.5 months each and every day, starting from 10th Feb till 28th May is the last day. So approx 3.5 month duration, we will cover everything regarding these 3 subjects, the theories also, the practical also, the MCQs also, everything with the latest CBME curriculum. And every day there will be live class only for 2 hours, and recordings will be available till 1 year if you are missing the live class anyways. Okay, so this batch we are launching with 2 goals, keeping in mind 2 goals. Number 1, the student should have a solid foundation for NEET PG in the second prof itself. So in the NEET PG, you are of course having 19 subjects. You have to deal with 19 subjects. You have 200 or 300 questions depending on exam to exam. You have to deal with 19 subjects. Out of them, the 3 foundation subjects, that is patho, micro, and pharma, you have to complete them in second prof itself, so that you can get the time in pre-final and final to prepare for other major subjects. So if I will prepare you these subjects in the second prof itself, so that you can revise them directly in the internship. You don't have to deal them in between. Directly in internship, you just revise it in just few days, and you can crack any question regarding these 3 subjects, patho, micro, and pharma. In the second prof itself, I will prepare you. And second thing, you will get a distinction and gold in your university exam in the second prof itself with this approach. Okay, so what most of the students are lacking in second prof? In the second prof, most of the students study these 3 subjects, but in isolation. Basically, in the pathology, they just read the pathogenesis of the disease. In the microbiology, they study the microorganism. In the pharmacology, they study the drugs to treat it. But they study the 3 subjects in isolation. For example, in patho, they are studying CVS. In micro, they study GIT simultaneously. And here they are studying the drugs of the CNS. So they can't integrate. So they fail to see the overlap. And there is fragmented retention, poor retention, and difficulty in solving the clinical scenario based. So what is the best approach? The best approach is to study these 3 subjects in integration. So cherry on the top. I'm not teaching you only microbiology in integration. I'm teaching you microbiology system-wise integration with the integration of other 2 subjects, that is patho and pharma. Got it? So how this integration will work? So these are the major systems in human body. We will take one system. Suppose the first system I'm taking CVS. So first I will take patho. always. In Patho, I will teach you all the diseases in the CVS. Like I will teach you MI, like ischemic heart disease. I will teach you endocarditis here. Okay, rheumatic heart disease here, infective endocarditis. All the important diseases in your syllabus and second prof I will deal here. The pathogenesis, etiology of all those diseases. Then I will come on micro. I will tell you the microorganisms associated with them. Like in infective endocarditis, name the microorganisms, name the bacteria which cause that, name the virus which cause that. So we will study the details of those microorganisms. I have shown you the charts there. Okay. Then we will come on pharma. I will tell you the drugs to treat all these. So I will tell you antihypertensive drugs here, anti-arrhythmic drugs here. Okay. I will tell you the drugs acting on renin-angiotensinogen system. So all those we will deal here in pharmacology. In this way, we will integrate. So nearly in 1 week time, we will study CVS from all 3 subjects with the latest CBME curriculum. Okay, got it? Yes, BDS students can also join the batch. More or less the syllabus is same. But particularly we have taken the details of all MBBS syllabus. But if the syllabus, you can check the index, the BDS students, and if you wish, you can join. Okay, what you will get in this Prof Buster live batch, in this pack, what you will get? You will get many things. You will get live sessions daily, 2-hour live session daily. Okay, of the 3 subjects, Patho, Pharma, that the topics are pre-decided. The days are pre-decided. The schedule is pre-decided of complete 3.5 months. Okay, you will get the recordings. If you miss the live lecture, the recording will be available till 1 year. You will get the workbook pre-hand so that you can fill the workbook and that will synchronize the pace with me. If I'm teaching, you are not missing any point. Most of the points, 60% workbook is filled and 40% is blank. The important words are blank. You will fill by yourself. You will not write in workbook. You will write in your brain simultaneously while attending the live class. And that will be your notebook finally. Got it? Then I will provide you the notes daily. Notes will be uploaded in the app. You cannot take the photocopy of that, but that will be uploaded in the app. Annotated notes also uploaded in the app daily. We will conduct quiz daily after the class, daily 20 questions, depending on the topic I'm teaching you. Suppose I taught you MI today, so there will be 20 questions on MI. Suppose I taught you anti-arrhythmic drugs, so there will be 20 questions on that, MCQ questions. And these questions are, real exam based question. So you get such questions in your NEET PG and ICT. So in the second prof itself, you will have exposure of all those questions. So daily there will be quiz, 20 question quiz. Immediately after the class, you have to attempt it. Okay. TND sessions will be once a month. So total 3 TND we will conduct, in which in that particular month, 30 days, whatever I taught you in Patho, Pharma and Micro, we will give you 100 questions from that and I will discuss those questions live. Okay, so TND will be total 3 TNDs are scheduled in this 3.5 month batch. After that, master charts. I have shown you master charts only of Micro, but wonder if I provide you master charts of all 3 subjects: complete Patho, complete Micro, complete Pharma. So basically in the master chart, I will compare all microorganisms in Micro. As I told you, I will give you nearly 20 master charts in Micro. The same, what if we compare all drugs under a fixed set of heading in pharmacology? So all 100 drugs, 150 drugs at one place. So again, I will compact entire pharmacology in 20 pages. What if we cover all cancers at one place in pathology? All histopathology images at one place in master charts. So I will provide you master charts of all 3 subjects. Okay. And most important among them, the hard copy will be delivered and soft copy will be available in the uploaded in the app. Not only theory, I will prepare you for practical and viva voce. There will be live classes for practical and viva voce after completing the theory. After this 3.5 months, the next 15 days classes will be for practical and viva voce. On the app, there are 3 types of question bank we are offering. The university exam question bank, in which of all 3 subject, topic wise, chapter wise, long question, short question, very short question are given. Of entire university in the India, the most important university in India, you can see. I'm offering the MCQ question bank, in which all the MCQs, for comparative exams, NEET, PG, INICT and FMGE are given topic wise, chapter wise. And I'm offering PYQ question bank. PYQ. So last 3 year, previous year questions of NEET, PG, INICT and FMGE of these 3 subjects are covered there. So we are offering 3 type of question banks. So on completion of the chapter and topic, you should solve the question bank. So it's a one-stop solution for second prof MBBS students, where you are getting everything: the theory, the practicals, the MCQ, foundation for NEET PG, distinction in your university exam. You are getting everything here. Got it? Now one by one I will give you. I have already told you the detail. I will show you. So live sessions, I have told you the batches of 3.5 months. There will be daily 2 to 2.5 hour live session, 5 p.m. onwards, 5 till 7 or 7:30 daily. It will be, except Sundays, 6 days a week. It will be there. Okay. So total in pathology, we are having 27 scheduled session, 27 into 2.5 hour daily. So total it will be 180 hour live teaching. Okay. 180 hour live teaching. Total 27 sessions are there. And 60 hour live teaching in Patho. The same 27 sessions in microbiology and same 27 sessions in, so total 81 sessions are there in 3.5 months. Total 81 sessions. Each session lasts for 2 hours or 2.5 hours. So 180 hour live teaching will be there. And after every session, there will be a quiz. So there are total 81 quiz. So that is the module. So quiz will be after every live session, 20 question quiz will be there. Depending on the topic I am teaching you, the same topic quiz will be there. So to reinforce that topic in your mind simultaneously, immediately after the session, I'll provide you workbook. Workbook hard copy is not provided, but soft copy is provided. You can take the printout if you wish. And I insist you take the printout before the class so that you can synchronize with the speed. So workbook is 60% filled and 40% empty that you have to fill during the class for active learning. Okay, I will provide you the notes, daily the notes, the simplified notes with the flow charts, reproducible diagram. It will be uploaded daily on the app before the class itself. Okay, annotated notes also will be uploaded. If I am writing any extra information in these notes, it is not there in the notes. During annotations I am writing. So annotated notes also uploaded daily after. So daily after the class, you will get notes as well as annotated notes. Okay. TND session, as I told you, once a month. Total 3 TNDs are scheduled, 100 question each, and I will do the live discussion of those. So in the morning TND, you have to give the test. In the evening, I will do the live discussion, and you have to gauge where you are standing among all the participants. Okay, you have to see your rank. I will provide you master charts. I have already shown you the master charts of microbiology, but I'm providing you master charts of all 3 subjects: patho as well as micro as well as pharma. Got it? And important among them are delivered to your doorstep with the combo plan. They are free of cost, delivered to your doorstep, the master, so that you can stick in the form of the calendar we are providing. So you can flip the calendar one by one. You put the chart, you have to hang that calendar on your wall, and you have to see these master charts of patho, pharma and micro, and you have to learn them. Okay, so this is how master charts will be delivered in the form of the calendar, and it will be delivered free of cost. The hard copy will be delivered of all 3 subjects, the important one, and all of them will be uploaded in the app. These are the master charts. Okay, like this. Not only theory, I will prepare you for practical viva voce. I will cover all the exercises, potters, specimen, table viva, grand viva of all 3 subjects, patho, micro and pharma. Isn't interesting? Huh? I will provide you 3 type of question bank, as I told you. University exam question bank, you can see LAQ, SAQs of all university. MCQ question bank, okay, thoroughly covering all 3 subjects for focused preparation. Okay, here you will get tricky clinical scenario based questions also, image based questions also, and PYQ question bank, in which you will get last 3 year questions of NEET, PG, FMGE and INICT. Okay, so this is the schedule, detailed schedule of the combo plan. So in the combo plan, all 3 subjects are included: patho, micro and pharma. This is the color coding we have done, and test and series is also included. But if you are interested only in one of the subjects, so individual subject plan is also available. You want only patho, only micro, only pharma, that too available. You want a combo, that too available. Okay, all the offerings are for all. Okay, master chart, quiz, question bank, everything is for all plan. So if you are taking only patho, all the offerings will be for patho only. For micro only, and combo mein all the offerings will be for all the subjects. It's like that. This is the detailed schedule. As I told you, we will start from 10th of February. So we will go system by system. In the first 2 weeks, I am taking general of all 3 subjects: general of patho, general of micro, general of pharma. Okay, in the second week, I will take onco of the 3 subjects. Then we will come on immunology of the 3 subjects. Then we will come on hematology of the 3 subjects. Then come the systemic thing of the 3 subjects. Suppose CVS is the first system I will teach you. So first in micro, I will teach you the CVS infections. 3 days, we will take 3 sessions. Then in the patho, I will teach you vascular disorders and heart disorders. This is patho. And then in the pharma, I will teach you the cardiovascular drugs. All the antihypertensive, antiarrhythmic, drugs acting on renin energy, all the drugs will become here. So in 1 week, nearly 8 days, 9 days, we will cover entire series. Then similarly, we will start respiratory system, GIT, hepatobiliary, whatever system we will take, we will cover for all 3 subjects. All 3 subjects, that particular system. That is integration. Skin, soft tissue, again 3 subjects. Then CNS, again you can see the 3 subjects. You can see patho, then you can see micro, then you can see pharma. All systems we have designed the schedule like this. Okay, so day by day schedule with the topic is there. It's available in the brochure also, and these are the dates. You can see the dates. If you are taking the combo plan, all the dates are marked of the February, March, April, May. Last session will be on 28th May. The first session is on the 10th May. You can see. And if you are interested in one of the plan, either patho or micro or pharma, you should mind that particular dates in this calendar. Okay, now still if you are confused, don't worry. Don't enroll. Please don't enroll. You take a free demo for 1 week. Complete 1 week, 6 days. I mean 6 days. we are offering free classes, free everything. Okay, you just scan it and register for demo. Demo is free, but registration is mandatory. So you have to register here by scanning, or the link will be provided in the comment section of this YouTube session. After the session, the link will be provided. You can go via link also and do the registration. So please, I insist you to take a free demo and understand the meaning of real integration in the 3 subjects, that is Patho, Pharma and Micro. Please understand what I mean. Don't just take my words. You realize by yourself, you feel it by yourself, how worthy it is, especially for second prof MBBS student. How to study the Patho, Pharma, Micro in an integrated and most simplified way, you will have this realization. The 1 week free demo we are offering. And this 1 week free demo is not only the first 7 days, like from 10th of February till 16th of February. No, anytime 7 days free demo you can take. So you can take 7 days, anytime free demo. You can take that. Got it? These are the plans. If you are taking combo plan, you can see the pricing. In this, we are offering all 3 subjects in this price. It's a already discounted price, and we are offering all 3 subjects here. And individual single subject plan, you are taking either Patho or Micro or Pharma, one of them. So this is the pricing of that. You can appreciate it. This is the pricing. Okay. Still, if you have any query, please note down the number. You can post your queries here. And for registration, I have provided you the link. Or for registration also, you can drop a message here. It's 9321001103. Okay. The batch is starting from 10th of February. Any queries, kindly let me know. I will answer. I will address your query. So you are preparing this for, yes, absolutely, it will be sufficient for NEET PG and prof also. So this course is sufficient for both. Thank you so much for your feedback. Thank you. Deepesh, thank you so much. Any queries here you want to ask? I have given you an approach how to study system-wise microbiology, and I have told you how I am integrating microbiology with other 2 subjects also in my batch. So any queries you are having, please, you are free to ask. Thank you so much. Thank you for your precious time. Okay, thank you. Bye-bye. You can drop your queries here in the comment box also. Bye-bye. Good day. Bye-bye.